Welcome to The Pursuit of Health, the podcast for Americans for free choice in medicine. I'm your host, Reinier Schuur. Joining back on the show is Dr. Colleen Smith to continue our discussion of rethinking American healthcare from a philosophically informed and pro-freedom perspective. Welcome back to the show, Colleen.
Thank you for having me back, Ray.
So a recurring theme of this show is what exactly it means to pursue freedom in healthcare, especially from the perspective of medical professionals. But the thing is that most medical professionals don't think of their own experiences in terms of freedom or the loss of freedom. But they do explain their experiences in other terms, such as autonomy or the loss of autonomy, or the loss of control over what they can and can't do, and doing the right thing. And there are all sorts of experiences that medical professionals face in the healthcare system that points to a view of freedom in healthcare and the loss of freedom in healthcare.
Yeah, I think we've spoken about one example of this in prior podcasts where I've talked about Center for Medicaid and Medicaid Services sepsis guidelines. This is a set of guidelines that's meant to improve sepsis care. And I think in some cases it has improved sepsis care. However, there's this small subset of patients that, for a variety of reasons, if you follow the sepsis guidelines as they're put out by CMS, you actually increase the risk that this small subset of patients can have bad outcomes from the way that they're being treated. And so that leaves doctors like me in the emergency department in this difficult situation where we have to decide, do we follow the guidelines and potentially harm our patient, or do we not follow the guidelines, take better care of our patient, but not get paid? And these kind of situations are pretty difficult for doctors. It can be really frustrating to be faced with these types of decisions day in and day out. Am I going to do the right thing for my patient or end up in front of my administrator for not meeting sepsis guidelines and losing income for the hospital?
And that taps into a wider narrative that you hear quite often when American healthcare is being covered in the media of patients versus profits, or the fact that doctors are pressured to pursue profits over patients, and the general sense that many doctors feel like they aren't free to do what is right by their patient, and that they have to choose between what is right for their patient, right for themselves, and making money for whatever organization that they work for. Now, this is a very powerful narrative, and it points to a view of freedom in healthcare, which we've covered before in this podcast. This view that what it means to be free in healthcare, especially for providers, is a kind of freedom from markets, freedom from pressures of commerce, of competition, of the need to advertise your services, of the profit motive. And if that is your view of freedom, well, then freedom has certainly been lost in healthcare. But this is certainly not our view. And as we've indicated in previous episodes of the show, our view is that freedom properly conceived in healthcare for providers is the freedom to operate on the free market. And that things like commerce and the profit motive is what enables that freedom. But the problem with our view of freedom in healthcare is, how do we contend with these stories where there appear to be all sorts of conflicts between pursuing profit and doing what's right for the patient, or doing what's clinically the right thing to do? And so that's the challenge that we want to take on for this episode. In particular, we want to make the pretty bold claim that it is precisely the view that freedom means the freedom to pursue profits that at the end of the day better explains those kinds of situations where there appears to be a conflict between pursuing profits and doing the right thing, precisely because we are not free to pursue profits. There are all sorts of ways in which that freedom is corrupted, is constrained by regulations, by laws. And so for us to have real freedom in healthcare is precisely the freedom to pursue profits.
Ray, it seems like you're saying that the traditional view of medicine, the view of medicine that supports all of our approach to medical care today in this system that we have, is that um, medical care in general should not be tied in any way to seeking profits. And I think that's really interesting. I do think that is what the current medical view is. In fact, I was specifically taught in medical school that the problem with profits in medicine is that it stops doctors from doing the right thing because they're more concerned about profit than they are about what's right for the patient.
Yeah, and I hear and see that all the time that people's ideal for medical interaction with the doctor when you go into the doctor's office is that you don't want to think about what something costs, and you don't want the doctor to think about what something costs. You want them to just give you the best form of treatment, and you worry about how you're going to cover it later on. And that view that, well, in the doctor's office, we are just going to focus on medicine. Once you leave the doctor's office, then we can figure out how to cover it. That view has very deep roots in medicine. And you see this with the AMA in the formation of modern medicine in America. This was certainly their view, and it informed the kinds of models for interacting between doctors and patients that they advocated for. For example, the solo practice model. Because their view was that, yeah, doctors obviously have to be compensated for their services. But the view was that an ethical doctor is someone who can see a patient, give him the best possible treatment, but then separate the question of how to pay for that treatment after the fact. And so there's no corruption of medical judgment when it comes to questions of what things cost, which is why they had things like sliding scales, where a doctor could charge a poor person less and a richer person more. And there was a general sense that at the end of the day, the doctor would make things work out, like would make things whole, financially speaking. And it was seen as a kind of a taboo to like put a dollar value on the judgment of a doctor on a particular treatment. And this is also the reason why the AMA went after group practices, which we covered in previous episodes, precisely because these group practices didn't do that. They didn't separate the question of clinical judgment from putting a dollar value on certain things. It was a threat to the AMA's model, especially when these kinds of models were successful in attracting doctors and patients and in integrating care at a higher and higher level.
Well, wasn't it the case that there was also some concern at the time that that the competition of these group practice models and competition between doctors, which is another aspect of free market systems, would further lead to issues wherein medical care was considered secondary to profits?
Certainly, and the AMA had the view that if we let these group practice models, or really any other model other than the solo practice model, exist, then doctors will feel pressured to join those other group practices, and patients would just go for the cheapest thing on the market. So there's definitely like some kind of paternalistic view that the AMA had that if we let the free market reign, then there'll just be a race to the bottom. Patients will just get whatever's cheapest. They won't be able to judge what's good, and doctors won't be able to convince patients why they should pay a little bit more for a better service. There was definitely the view that, well, in order to protect the sanctity of clinical judgment, we need to protect it from things like competition, from the profit motive, from really any kind of commercialization, and that's the word that they used. But as we covered in our previous episodes, the solo practice model was simply not sufficient to scale healthcare in any way that was needed to meet the growing demand. Both because of technological developments and both because there was a demand for more and better healthcare. And so the AMA realized that, well, we need to allow some kind of industrialization for healthcare, which is why they accepted the health insurance company model. And what's interesting about that model is that, well, as we discussed in previous episodes, it's not health insurance. It's really a form of paying for healthcare that the AMA approved of. And one of the conditions for uh, which they approved this arrangement is that insurers couldn't tell doctors what to do, that their ability to say that a patient needed some treatment would not fundamentally be questioned.
Yeah. I think the other condition that I think is a major condition was that insurers could not set prices or argue about prices. They simply had to pay whatever the doctor charged, which is another aspect in which this is maybe not true insurance.
And what that did was is that it created a situation under which doctors could keep continuing to practice medicine the way that they were. They didn't have to think about what something would cost and wouldn't have to discuss that with the patient. They could just bill the insurer.
Yeah.
And unlike the sliding scale model, where the doctor themselves had to make themselves financially whole, right? And they could charge more or less depending on what a patient could pay. Now they could just charge on the upper end of the scale each time and bill that to the insurer.
At least with the sliding scale model, doctors had to have some consideration of what was a reasonable payment or what you might expect someone to pay for the services provided. But under the insurance company model, they didn't have to consider that anymore. The insurance company had agreed to pay whatever they were charged and not to question the doctor's decisions.
And so from the perspective of doctors, under the solo practice model and the insurance model, they were free. And out of nowhere, insurers started demanding that they justify what they were doing, that they had to impose controls at some point. And there's this very common narrative that, well, at some point, healthcare started being a business. Before, it was primarily an art, a practice, and then insurers started imposing controls. There was pressures for doctors to start thinking about money. They started joining big practices and hospitals, and more over time, the profit motive took over to the point that we are now, where they're in the situations that we described before, where they feel like, well, now I'm not free. Now I have to choose between doing what's right for the patient or making money for myself, my organization, or the insurer. And so, from their perspective, they lost their freedom because we allowed the profit motive free rein.
Yes, doctors did experience a loss of freedom because they gave it up. In their quest to be free of a concern for profit in any decision that they made about patient care, doctors gave their right to practice in a way that was market oriented or that considered a profit motive over to insurance companies and government regulations. They lost their autonomy. And in order to get it back, to have real freedom in medicine, doctors must embrace the profit motive that they've been afraid of all this time, not be free from it.
And I think what's relevant there is that is certainly not the view of the profit motive from the AMA or really many people in the medical establishment. Their view of the profit motive is that it's scamming people, it's short-term interest, it's screwing over your patient. And there is that phenomenon out there in the world where you have snake oil salesmen who sell you crap and then run out of town. But that's not the the only view of the profit motive. And from my perspective, that's not the proper view. The proper view is that the way that you make profits, make a lot of profits, is by serving your customers well, long term. It's the attitude, it's the mentality of looking how to create value and trading it. And you don't do that by screwing over your customers. You do that by coming up with something new and convincing someone and persuading them for why it's better. And I also think that this is why the group practice model was such a threat to the AMA, because what they did was they put a monetary value on all sorts of things in healthcare. And it's also, I think, why they were better. They had this model where they aligned the profit motive with health, where doctors had a base salary and they would get a bonus of the profits from the end of the year based on the annual or monthly subscription from patients. And so they were not incentivized to overtreat patients or undertreat them. They were being rewarded for withholding care when it was the right thing to do. And it shows that if you actually leave the profit motive free, people can come up with these models where they are justly rewarded for their clinical judgment.
I mean, we're seeing something like this play out with direct primary care practices today, where the subscription fee includes a multitude of visits, lab testing, various imaging, but also encourages doctors not to overutilize those things. On the other hand, if a doctor were to underutilize those included features of the direct primary care subscription, ultimately the patient doesn't stay healthy, they don't respect their doctor, they don't stay, they don't come back for the next year, and the doctor stops making money. This is an alignment of incentives where doctors really are working to make a profit off of the subscription fees that their patients provide, and patients are getting the best care that those doctors can provide in order to encourage them to come back year to year.
And so that's the view of freedom that we're advocating for, where it's the profit motive that makes it possible for doctors to be rewarded for their clinical judgment, where they get to monetize their own judgment. But that's a view again that the AMA rejected, and if that's clear, then it paints a very different picture for how doctors lost their freedom in healthcare, right? So when the AMA realized that they needed to bring in some third-party payer to scale up healthcare, and they told the insurers that, look, don't tell us how to practice medicine. You just pay the bills. That's not freedom. That's giving up freedom, right? Because under the group practice model, the doctors themselves were able to put a monetary value on what they were doing and be rewarded for it. But under this solo practice model, health insurance company model, doctors didn't have to do that, and they weren't rewarded for offering a service that was cheaper, more innovative. Really, their only incentive was to practice medicine in a vacuum of the kinds of questions like what something costs and the kinds of controls that the health insurance company models ended up imposing were inevitable. They're being painted in this alternative narrative as, well, the insurers got greedy and doctors got greedy. It's like, no, you gave up your freedom, and so the fact that they had to impose controls was just a matter of time.
And those are the things that we're seeing today, like prior authorizations and um, this kind of medical dance where in order to get an MRI, you have to get an X-ray first, whether or not the X-ray will be helpful at all. But you have to check the boxes of the things that the insurance company requires before you can move on to the next step. And while sometimes that might make sense, there are other times that it doesn't make sense, but it's one size fits all medicine as dictated by the insurance company that is trying to control prices since they're the ones paying, rather than dictated by the patient or the patient working with their doctor, which would be the ideal situation in a system that allowed free markets and profit motives to work as they should.
Yeah, I think that's exactly right. And to make this very clear and concrete, the the kind of mentality, the kind of mindset of a businessman where you try to figure out inefficiencies in the system, um, new products, new services that you could sell, and persuading someone to pay for them. That's certainly not the attitude of most doctors, and it's not something that the system currently rewards. What the current system rewards is coding for what already exists, and you're not encouraged to lower your prices. And so the fact that people paint what doctors do and these kinds of conflicts where they have to choose between profits and what's right for the patient as due to healthcare being turned into a business is ridiculous. It's just not true. It's because the system that we're currently in does not reward the profit motive properly conceived, which is a trader relationship. Rather, it seems that doctors are treating insurance companies like ATMs, and insurers have to stop the flow somehow. And so they're constantly trying to deny care, but that's not how things would look like if they were in a proper trader relationship, where doctors were free to convince an insurer that, hey, I can save you money and we can save the patient money, and that way I can get more business. Well, good luck trying to do that under the current system. You're not allowed.
In fact, it's exactly the opposite of like a free market, pro profit motive capitalist system. And we're seeing people say that, oh, this is capitalism today, but this system is not capitalism in any sense of the word. And in some sense, it has done what doctors wanted. It's eliminated any competition between doctors. So this fear of competition that we alluded to at the beginning of the podcast, ha our current system has eliminated any competition. But really, we should want doctors to feel competition. We should want them to feel pressure to do better, to take better care of their patients, to come up with new innovative techniques and even just processes for how they run their office more efficiently so that as the patient things can be more efficient. Instead, we we've lost all of those things that are inherent in a system where you have a trade of values that seeks to increase profit in exchange for providing a real value or service.
That's right. And I think it's a real shame that doctors are still tied to this view that in order for them to be free, they just need to get out of the grip of some big business pursuing profits, because that's precisely the system that they're not in. The businesses are not actually free I mean, it is true that profits are being made, but how they're being made, every part of it is determined by someone else, by the insurer who's being regulated.
I think I can illustrate this using the sepsis example that we talked about earlier. So the Center for Medicaid Services has a set of required actions that must be taken in the case that a patient has sepsis. Those actions are one size fits all medicine and don't take into account the subset of patients for whom some of them would actually be detrimental to their health. Like they wouldn't do better if I do these things. There are ways that I can figure out which patients need the intervention and which patients don't need the intervention. A lot of them are related just to the patient's own medical history. Sometimes it's a little bit more work for me to figure out that I shouldn't do the thing that the sepsis protocol requires me to do. So it's just fascinating to me and I think really illustrates the point that profit making money for doing the work is not connected in any way in our current system to doing the work well. When I say that, I have to do extra work to figure out which patients should not get the sepsis protocol intervention, which I then will not get paid for doing because I didn't follow the sepsis protocol. So to me, that is a perfect illustration of the degree to which The lack of having a clear profit motive in our current system results in patients getting worse care. There's no reward to me for providing better care for my patients.
And I think another phenomenon that is worth talking about when we're talking about loss of freedom and the profit motive in healthcare is what you talked about earlier, Colleen, which is the direct primary care model. A lot of people point to that model as a way that doctors have been able to escape working for big insurers and big healthcare companies and corporations. And sometimes they'll even put it in terms of, I don't feel this pressure to make a profit for a big company. I can focus on just my patient. But from my perspective, what allows these doctors to gain back their freedom to practice medicine is precisely because in this one little area, the profit motive is not as regulated as it is if you take health insurance, right? So that's what is liberating these doctors, not the fact that they're escaping big businesses, is because they can set the terms for their services and they can be justly rewarded for it.
Right, they're actually getting paid for making medical care more accessible, for doing the extra work to learn that they don't need to intervene in some way or do, but they're getting paid for it.
And so, what I hope we've done in this episode is to have not only push back against this broader narrative of there being a conflict between patients and profits, but to come up with a framework from which we can explain other phenomenon that people talk about in the healthcare space, such as moral injury, the fragmentation of healthcare, the claims that we have a sick care system as opposed to a healthcare system. I think a lot of these things are much better explained by our view, which is the view that we are not free to pursue profit in healthcare. The way that we can pursue profit in healthcare is not free and very much constrained. And that much better explains all these sorts of problems that we're talking about. And with that, would like to thank our audience and till next time.
Till next time.
To stay up to date on our newest episodes, subscribe to our show from whatever podcast platform you are listening from. To support our show and Americans for Free Choice in Medicine, you can make a financial contribution at www.afcm.org/donate. Thank you for listening.